I am Dr. Gupta from the Diabetes Hypertension Center. Continuing on the series of people that we have had giving testimonial, we have always taken the attitude that we need to present with you a reality. And this is Dr. Gupta in reality, in person. And I'm going to talk to a real patient, which should be a surprise to you, because nowadays we get all these beautiful looking women, beautiful looking doctors that are not really doctors. I want to welcome a patient of mine to the testimonial series, and tell us a little bit about yourself and how did you find out about us?
My name is Kathleen Albert. I've been coming to Dr. Gupta's office for about 3 years. A person at work referred him to me, and he actually came with me on my first visit, and he said, "You're going to get much better." He also has diabetes and high blood pressure, and he has diabetes pretty bad. So that's how I came to know Dr. Gupta, from a reference or a personal reference.
Now, so from what you were told by a friend of yours about the Diabetes Hypertension Center, tell us what your experience has been having come to this office now.
My experience has been a very exciting and good experience, because when I first came, he said, "Kathleen, I want you to have your blood pressure like 120/70 something." And I'm like, okay, for years my blood pressure has been 170, 180, 190. And it took about a year, and I told him, I came in the office that day, I was on a regular visit. And I said, you know, I really have to thank you, because I never thought that my blood pressure could come down that low after suffering with high blood pressure for so many years. So that's been the most wonderful experience, to get my blood pressure down. You can't say something.
Tell me, how has other aspects of your life been since you've started coming to the Diabetes Hypertension Center? Such as your cholesterol, your kidneys, eyes?
I think everything is good. Dr. Gupta has all his patients take the Berkeley Heart study, and I've had mine done twice, so it tells a lot about the genetic part of your body, and I think that helps. That's a lot of information that you probably didn't know about yourself, but he can learn a lot from this test. So he gives it to everyone, and my blood pressure, it floats. I have a lot of stress, and he did tell me I need to reduce my stress. But I have a lot of stress, and I think that's more what really brings on my diabetes.
Now, tell me another interesting aspect. Weight is often an issue, and what have you learned having come here and attended that, how to handle your weight issues?
Well, I'm slow to lose weight, but that's the next goal that Dr. Gupta and I have, is to get my weight down. He has 5 rules, 5 little things he tells you. You need to eat 5 meals a day, 5 bottles of water, or 5, I don't know what glass, but what size. You need to get your exercise, and let me see what the other one is.
Weight training?
Yeah, your weight training, and
5 to 10% change in your diet.
Yeah, 5%, 10% change in your diet. And he knows that this may go a little bit slower. He's not expecting you to do it, but he repeats it every month so that you kind of get it. You know, when you hear it over and over, it kind of registers.
Tell me another aspect, what has been your experience overall coming to the Diabetes Hypertension Center? How have you found Dr. Gupta? Does he listen to your problems? Do I listen to the issues you have? And how have you found the atmosphere in the office?
Well, let's start from the time you come in the door. His receptionists are very, very nice people. One thing about Dr. Gupta, he's somewhat of a perfectionist. I've noticed that. He takes care of his patient, he takes care of the front office, he makes sure everything is okay. If something's wrong, he'll tell them, no, you need to do it this way. So I find that that's a very good atmosphere, to have someone to care about what's going on in the front office as well as the patients in the back. He has beautiful surroundings, so that always makes you feel comfortable. I came in here the other day, I was very sick, and I called him. I hated to call him, but I was having a lot of pain, and I also had an appointment that day. And my appointment was at 11:30, but I didn't sleep. So I called him, and he recommended I go to the emergency room. Well, I'll tell you something. When you go to the emergency rooms and other people, I felt like I was a number that day. I got there about 8 and I was out by 10:30, which is marvelous for an emergency room. The drugs that the doctor gave me, I didn't feel that I should take them. One was Valium, and I'm not really good with that. And he gave me a pill, and he asked me, he said, "Has your pain gone?" And I'm like, "No, it has not gone." The nurse kept asking me the same thing. So I came to see my own doctor, which I know cares about me. And we got some new prescriptions, and I can say I feel better. But that's why you need your own personal doctor, because he knows what medications agrees with you and what won't agree with you. So I find that you care about everybody.
Tell me if, 1 is really very bad and 10 is exceptionally good, how would you rate the healthcare that you're provided at the Diabetes Hypertension Center?
I'd say 10 and above.
Tell me another question then. If 10 is you feel very confident that the future is bright and you are doing well, 1 is all doom and gloom and everything is going to be bad and you're going to end up dying, how do you rate your own self and your health today compared to what you were 3-4 years ago?
I believe my health is pretty good. When I first came to see Dr. Gupta, I was on a lot of pills, and immediately he took away about 4 or 5 of them. Okay, but I'm on a lot of different medications, but one thing he tries to let you know, that if you keep trying to improve and do what he asks you to do, you can come off some of the medication. But it's all in your hands. You really have to try to do what he says. Make sure you come for your visits often. And another example, I came to him and I was having trouble with my legs, and I ended up having like a herniated disc. And so he sent me for therapy, and I was so glad, because a lot of people said, "Well, let's have surgery, let's have surgery." And I don't think he's like that. He's like, "We're going to go through the steps. If surgery is necessary, we'll just wait until the end." And I thought that was very good of you not to say, "Oh, let's go to the surgical floor." I'm like,
Thank you, Kathleen. I really appreciate you taking the time and candidly sharing about your experience at the Diabetes Hypertension Center. Thank you. God bless you. It's been a pleasure looking after you.
Thank you, Dr. Gupta. Appreciate it.
You're welcome. Thank you, everybody.